So we'll just go through the sort of more explanation of, one, the bronchial tree itself, but also two, more specifically, how I can remember, or how how you can think about the tree in order to help you remember how you can regurgitate it. The second thing is it's also important to know the clinically relevant anatomy, and I'll just highlight that briefly as well. So started with the trachea, talked about the carina, bifurcation at T4. The right main bronchus is maybe worth mentioning. It's shorter, fatter, and has a less acute angle, so you're more likely to do an enterobronchial intubation on the right-hand side compared to the left in adults. And then at around 2.5 centimetres further on, then you have a trifurcation. That word just seems to fit really nicely. And it sounds like you know what you're talking about. The right upper lobe, as we described, the anterior, posterior and apical, and I remember that this is symmetrical with the other side. So on the left upper lobe, you've also got APA as well. So, but you just have to remember that this is apico-posterior. The two lobes have joined together. And the reason why that this is sort of relevant is because the lung has 19 lobes, and if you think about that, you've got 10 on your right and 9 on your left, and that's how you can sort of remember what side it is as well. So with the bottom, so with the lower lobes, this is always, I found a bit difficult to remember until I thought about it as a box. And if we have draw a quick box here, if you think about the box itself, it has 6 sides, but if we discount the bottom, so that's sort of not something we're going to talk about, then it's got 5 sides. And if we just think about the sides in relation to what we're trying to describe here, so there is a superior basal lobe, a middle, a lateral basal, an anterior basal, and a posterior basal. And if you think about those, we've gone through the 5 lobes of both of the lower lobes, and that seems to fit fantastically well in helping me remember. And then we've only got like the right middle lobe and the lingua on the left hand side, and I mean there's no easy way to remember this really, apart from just brute force. AM on the right, sorry, and then superior and inferior on the left. I hope that's cleared some things up.